Investments in Nigeria's banks in the country's health sector could reverse the trend of health financing in the country. In an exclusive interview, CNBC Africa Umu Ibrahim caught up with the group Deputy Managing Director at Access Bank and started by asking how important health financing is to the banking sector.
As a country, even if you are recording significant growth in your GDP, you need a healthy workforce for it to be sustainable. So we know that it is important. But what is critical at this point is for us to be able to get Nigerian banks to begin to focus more and more in supporting that sector, and for government to come up with initiatives, all right, that would basically tilt Nigerian banks towards looking at that sector even more than before.
Do you want to quickly take us through some of the emerging trends in health financing in Nigeria today?
There are certain things that are coming up now. You have the Nigerian Health Insurance Scheme that has basically built up funds, and the whole idea is to basically use in supporting health infrastructure. All right, it is still at its very nascent stages, but there are several schemes. Some of them are geared towards supporting what they refer to as community disadvantaged areas, where they help widows or little children or orphans, all right, to support in paying their medical bills. All right, but like I said, they're still in their very nascent stages. Now, if you look at a country with 160 million people, all right, and you ask yourself how far and how deep is the medical infrastructure, then you begin to see that we have not even started. Today you have very interesting terms. They call it medical tourism, all right, where Nigerians almost have to travel for any type of ailments. Even, you break a limb, you need to travel. You have cough, you probably need to travel, etc., etc. That is because our medical infrastructure, all right, has not advanced to the point where more and more serious ailments can be treated locally. So there's still a whole lot that needs to be done. Medical facilities are not luxury. They must be affordable. They're not for the wealthy, and they must be available to everybody.
Your thoughts on how health financing in Nigeria could be made more attractive and sustainable to the Nigerian banking sector to thrive, the country's health sector?
There are several ways in which medical financing can be made interesting. Just the same way agric has been made interesting, the government can create tax breaks for institutions that fund health facilities or health infrastructure. There are ways, in which they can make sure that Nigerian banks begin to partner with multilateral agencies or donor-funded agencies to make sure that they come up with their own funding. They can also introduce some form of taxes, just the same way you have the education tax. All right, I think health is another critical area. If people are young today, they will need those facilities in the future. If you don't have a communicable disease, you would have people who have suffered from non-communicable diseases. And if you see the overall impact, it's extremely important. Now, Access Bank has been at the forefront, I'm sure you know, in terms of shaping certain critical policies as far as the real sector is concerned. And for us, healthcare is also one of those areas we're beginning to turn our searchlights on. And we're going to be working with our colleagues in the industry to try and de-risk that market so that it becomes a market that we all can play in. And also, work with government to come up with initiatives that will make funding for medical care and health infrastructure easier for people.
75% of the fundings for pandemics like HIV, AIDS, malaria, tuberculosis are from, international donors, whereas 25% is said to be from the private sector. How do you think we could turn around this?
There are several ways in which you can turn it around. One of the most important ways in which it can happen, actually, is to create, certain tax exemptions. Now, world over, what you tend to see is that even where there's government support, in several places, it's been led by the private sector. In fact, the idea of, the whole of this symposium we've been running is, can we switch it around? Rather than have 75% government or donor funded, can we make it 75% private sector, 25% the other way around? And I think if we can sit together with government to shape the policies, all right, that would provide an incentive for banks to do it, I think it would work. If government could legislate and say, banks should contribute a specific percentage of their profits towards health financing, it would work. I mean, they don't have to pay to them if they insist that it can be used to support medical care. Certain things can happen, But there's even a much more interesting school of thought. I believe that the private sector can come together and work together with certain civil aids organizations, certain faith agencies, and come up with an appropriate framework, all right, with respect to how do we take medical care forward, how do we take health infrastructure forward, and it would cover everything down to the insurance, all right, which we can make mandatory for people who are working, as far as healthcare is concerned.